Hello again, Dr. Peter Montgomery, family practice doctor, here to give you another COVID update for April 6, 2020. Thanks for joining me again today. Got some good news on in a tough time. Things are actually starting to turn the corner. I'm going to show you that data in just a little bit, and then talk a little bit about how we do medical logic thinking through this difficult time when things are so gray, when there's a lack of black and white. What are your doctors thinking, and how are we processing this data? And hopefully that'll help you understand that we're going through, that you're going through the same thing, see how we process it. Hopefully that might give you some comfort to what we're doing and the method. So stick with me here. So I'm going to give you a little update right now on how things are going. Okay, here we start off with the Johns Hopkins global map of the COVID analysis. 1.3 million confirmed, and modelers of disease spread said this is probably 10 times this. I know I said it's going to be positive, but the death numbers are actually rather accurate. So we look at this and say there's a 4 or 5% death rate of people confirmed. Of actual numbers, it's probably still 0.4, 0.5%, which is still 4 to 5 times worse than the flu. It gives us a better idea where things are going. So the world, we're still on, again, looking at charts, there's a straight phase and then a going up. We have a logarithmic chart. It kind of makes the numbers a little more sensible. We see things are still heading up, but there's a beginning, a start of the curve that you can't see if you look at the straight numbers. The logistic gives you a better input. And we can see that for 2 days in a row, new cases are down for the world. So I wanted to say I put a positive spin on it. That's a pattern I'll show you again. Now it's happened here before and it went up again more. So you like to see 3 or 4 more days down in a row before getting really happy, but it is a positive trend. And looking in some countries that are already starting to turn the corner, here's Spain. They've had a very bad time. They had a very fast rise up to their peak, but then they had 4 days in a row, and that was a sign of continuing lowering. Even though it bumped up a little bit more, the peaks keep steadily going down. Italy had a peak, and even though there's been some low days, high days, their peaks keep coming in at lower and lower numbers. So that means that was their peak day. So well over 10 days past their peak cases. And they announced yesterday they had their peak deaths. The deaths yesterday was less than the day before. So that was first turn, and that let a lot of people sigh of breath of relief, like, okay, things do turn around. We're getting there. Um, Germany was very on it early on, had a peak, maybe a false peak, because then there was that, but they're 4 days in a row steadily down. Very good. France, their numbers are kind of skewed there, making it hard to read. United Kingdom still going up, 1 day down, not a trend. Switzerland steadily coming down. So you can see all their lows are steadily going down, even their peaks are coming down. So a lot of turn there in Europe. In the US, like I said, we got 2 days down, 3 or 4 days. I feel a lot more favorable towards that. And then be able to break that down state by state. New York is still doing the worst. To tell that, go to another map. But before even doing that, I'm going to go back to the US weather map. Our temperatures peaked for the nation on around St. Patrick's Day. The 17th to the 20th, we had a peak. Social isolation really peaked in, I think, flattened that peak out, and it's been going down. It's still going down, not as fast, but how low can you go when this is average? We are much below average. This is actually a number of people ill, because when you go on the log on the site, you also give your symptoms along with your temperature when you log a temperature. Normally we're about 3.5%, almost 4%, and we are down here around 1%. We are a whole lot healthier than we normally are because of the social distancing. So peak temperature was about there. We're getting to peak cases about 2 weeks later. Peak hospitalization will peak in about another week. Peak deaths about a week after that, and then down. So everybody's saying about 2 weeks. I think they're right. Easter's in 1 week. Uh, Eastern Orthodox Easter's in 2 weeks. So I think that's kind of, it still gives us a positive day there. So going to the worldometer, where it gives us more world numbers, we can hit total cases in the world. We're a large country getting hit here and being straightforward with our numbers, so we're on the top. Italy, Spain are rather small countries comparatively and rather big numbers. So to get a more accurate number, you can look at um, total cases per million people. Some of the smaller countries are really concentrating getting hit hard here, and then here's Spain there. Sadly, the most accurate number, because cases are so variable depending on your testing. Deaths are a lot more concrete number to go by. Spain and Italy still at the top here. Again, Belgium, France, Netherlands, that whole section there, they're all close together, had it rough. Switzerland, north of Italy, had it rough. UK just across the pond, but still not much for protection from it there. Sweden, of the Nordic countries, is having it rough still. Finland is doing much better. Finland, their death rate per million is 5 compared to 47, so significantly lower. USA is here, and coming down. Germany doing a lot better and already have turned the corner, so their numbers are not going to rise as much. Sadly, our numbers are probably going to still be rising for a bit for the next week or two. So here's the world average. We are above world average on deaths per million. Countries doing better. Canada, way to go. Greece, Israel, lots of other countries here doing better. Some places are not showing up here because it really hasn't got to them. For some reason, Russia is having a delay. I guess it's good that they did a good job of delaying it. Sadly, it is upon them. The Russian numbers here, they're still on the straight up. The logarithmic scale is still rather straight here. So there's still probably another week or so from their peak cases, maybe 2. So actually, it'd be better if they're 2 weeks from peak cases, because that means they're actually doing a good job of flattening the curve. The quicker you hit the peak, the quicker you get the patients getting sick and get in the hospital. You want to do everything you can to slow that down and keep that below the capacity of your health system to get the best outcomes for the people there. Because not only people suffering from the COVID, people are still having heart attacks and strokes, car wrecks, and other injuries that need medical care. The medical system has to keep operating and take care of everybody. As other people are unnecessarily suffering and dying because of all the COVID cases. So we've got to keep that under control. So how do doctors keep control and filter out things when things are so vague, when we have tests that are 70% accurate or can't get access to the test? We use a thing actually called fuzzy logic. Fuzzy logic is when you have truth values, when things are not 0 or 1, are not black and white. There are variables amount of truth that we're getting coming at us. Not saying that patients are lying to us, but patients lie to us. So this started back in the 1920s when they started doing the math and formalized it about 1965 or that. But where it gets used a lot is in medical decision making, where we have to apply different ways with it. I like how they name things in this. The first step is fuzzification. We kind of put things in a group. It's either cold, warm, or hot, low, medium, or high. What's our trust value of what's going on, from what's our gist, what's our gut feeling. In residency program, we had I was a senior and chief resident that had, the very nervous first year medical resident, and he was nervous because he wanted to get it right. He was very motivated, very energetic, but he needed to take a step back and get the emotion under control. And so you present a patient, and I'd stop and go, low, medium, high, good, bad. Just give me a feeling for what you just described. And he goes, okay, all right, so let's go with that, stick with that concept. And often we look at a room and, look at a patient and I'll shut the door. I go, what'd you see? You know, good or bad? Was the person in there crying? Was the person in there, reading a magazine and comfortable and relaxed? So get that impression, get that first part, that fuzzification. We got lots of bizarre information. Let's break it down. Um, there's actually a circuit board here, way of looking at it. There's the pre-processing. This is what we're doing here. But what happens before the patient comes to us? The patient, the data, the world. Then it comes to us, and then we go through fuzzification. We break it down. We get the history. Is the patient telling me the truth? Does the patient know the truth? There's some really important aspect that they didn't tell me about because they don't know it's important. So we got to gather all this data, and we have a process for this. It is an interviewing, investigative process. So we break it down and get a gist, and based on that gist, then we apply the rule base and the inference engine. In medicine, we say basically this is our medical training. This is the physical exam, the vital signs, the laboratory testing, the CAT scans. The inference engine is, all that. And then we process all that, and then we defuzzify. We go, okay, you've got X, or you've got A or B. What are these two conditions? We narrow it down, and then we have a plan. A lot of medicine is based on algorithms. If this, then that. And so we come up with a plan and we put it together. Say we're going to either do this further testing, see the specialist, or we're going to start this medicine or have this surgery. And then there's you leave our care and you go either don't take the medicine or you do take the medicine. I've told people, hey, this looks like cancer. Go see the cancer specialist. They come back 6 months later and go, hey, I still got that lump. I go, yeah, and I sent you to a cancer doctor. And so, they did the wrong thing with the information. Or they go, I decided I'm just going to take a lot of, some insert thing here that was not what I told them to do. And it didn't work. I'm like, okay, that didn't work. Please go back to the process. We start again. Okay. So with what we're going through, a lot of people are, taking this overwhelming data here, and some people we're processing it, coming with a plan. The plan is healthcare. It is what I call the 5 W's: the washing, the waving, the wiping, the woe, the being excellent to yourself, getting good sleep, getting regular exercise, taking zinc and vitamin D because they've been proven to help, and do what you can. So that's the right thing to do. That's the pre-processing that you can do there to help prevent yourself from getting sick. And if you do get sick, to have the best outcome. Stop smoking now. Stop drinking now. And the other thing is be excellent to each other. Take care of each other. Some people, on the back end of the process, they're doing the wrong thing and they're burning down 5G cell phone towers. Seriously, look it up. That's happening. People are doing some crazy things out there. I'm not trying to give them too much credit. So I'm not going to repeat some of the dumb things that people are doing, but people are not processing this very well. And so we need to get useful, helpful information out to them that cases are starting to turn the corner and come down. That even the worst stories, the numbers are starting to improve. We can control the wave, get it under to the level where our healthcare system can control it so we can still take care of all the other sick people. And this just becomes another contagious disease we control. We will get better tests. Soon we'll have antibody tests, by soon months, but eventually we'll get antibody tests. We can tell who has been sick and who has not. If you already had it and you're immune, go about your business. You don't have to worry about it happening to you or you spreading it. And if you haven't had it yet, then you can continue to take excellent care of your body and watch out so you don't catch it. And soon we'll have a vaccine. In the meantime, we have treatments. People are getting better with treatments out there. We are doing the Zithromax and hydroxychloroquine has been helpful. I would consider that an early intervention, not something to be saved for the hospital. My job as a family practice doctor is to keep you out of the hospital. We don't want the hospitals overwhelmed, so we can give medications that have been used for decades safely and give them to people where there's been shown improvement and keep people out of the hospital. In the hospital, we give more advanced treatments in addition to that or instead of that, or people with multiple complex conditions where they can't take those medicines because it might make their heart skip. and those people get other medical therapies, including the IV antibody, which I read more about today, is progressing along, and other treatment like HIV drugs that Remdesivir, which is made by Gilead, which can be used in extreme cases. So we are getting better with this. We're applying this logic, and it's a constant loop. We just keep going back and forth through this medical process, this thinking process, taking in fuzzy data, analyzing it through our training and what we know, and coming up with a plan, and then doing it again. And so this is how we work through this. This is how you can work through this. This can solve many fuzzy problems in your life, this process system. The important thing that you work with functioning rules, rules that make sense, rules that are known, logic rules. And sometimes you got to look them up, discuss them with people. You should be able to come up with a reasonable set that works. So I hope this has been slightly positive as we are starting to get some slightly positive numbers. I do like to end on the map here. It says observed. Most of our temperatures are normal or normalizing. There are some hot spots that this map highlights, but there are places where people are keeping it very cool. The grays are not as sick and are handling the weight much better. Even the yellows and oranges are doing pretty good. The reds are the trouble. So hang in, everybody. So we're going to reprocess this again. So we're now at this point. I'm going to hand this off to you. You guys are going to process this data, come back tomorrow, and we will reprocess again as we keep working through this. And hopefully we'll get more and more good news and be able to work through this. So hang in, everybody. See you again tomorrow.